Experts say today's teens are growing up in a very different environment. Cannabis is legal for adults in California, widely marketed and often seen as socially acceptable. That can make it harder for teens to understand the potential risks.
We were able to follow nearly 500,000 adolescents who were confidentially screened for cannabis use as part of routine pediatric care. And then we examined the later onset of clinician diagnosed psychotic, bipolar, depressive, and anxiety disorders within that same cohort, whereas many studies have only focused on one mental health outcome at a time.
They followed adolescents ages 13 to 17 over an 8-year period. Among all the mental health conditions examined, Kaiser Permanente researcher Kelly Young Wolf says two stood out.
Now, the strongest associations were found for psychotic and bipolar disorders, where the risk was about doubled. And importantly, teens reported on their cannabis use about 1 to 2 years before their mental health diagnosis.
She says they accounted for other risk factors.
So we adjusted for things like sex and race and ethnicity, neighborhood deprivation, insurance type, other substance use. And, it is possible that some teens were using cannabis as a way to try to cope with early mental health symptoms. But we found that our associations remained even after accounting for prior psychiatric conditions.
The study does not prove cannabis causes these disorders, but Young Wolf says the sequence, use first, diagnosis later, is raising concern. Dr. Natalie Laub is a pediatrician at Rady Children's Hospital. She says she's watching similar patterns unfold in the emergency room.
Prior to 2020, we were only seeing a handful of adolescents a year, maybe you're 20 or 30. In 2025, we saw nearly 600 adolescents, young adolescents, present to the emergency room because they needed treatment of some kind for their cannabis use.
She says today's products are far more potent than what previous generations were exposed to. Laub worries many families underestimate the risk.
Start talking about this sooner than you think is necessary. If you're not talking about the dangers of cannabis until your child is 12, 13, or 14, it's probably too late.
Researchers say more study is needed, but they hope the findings help parents and teens better understand the potential mental health risks tied to early cannabis use. Heidi de Marco, KPBS News.